During the treatment process, you'll hear us talk about the idea that we're finding nerve endings that have become sensitive. But why does this happen? So if I break my elbow, and my elbow has healed as best as it ever will, then potentially, in order to protect myself from re-injuring that area, it's a normal thing for the brain to create now a heightened sensitivity in that area because it wants to stop re-injuring it again. And so trauma is the first reason for nerve endings that become sensitive. The second reason is simple overuse. If I have a repetitive strain injury where I'm doing excessive amounts of typing, for example, then I'm going to create some heightened sensitivity. And the third reason is more to do with a concept that we use called neurological health. And this is simple. If my brain is overwhelmed with information, I'm highly stressed, I've got lots going on, and then perhaps I start using my elbow a little bit, then it can't contemplate all this information at once. And so it may perceive now that this is a threat because it's just overwhelmed. And so those are the three reasons in which we can create heightened sensitivity in an area. Having heightened sensitivity in an area isn't directly going to cause you pain, but it most definitely increases the likelihood. And so we want to try and reduce that sensitivity so that at the very least, your brain is getting normal information from that elbow, and so it doesn't believe that there's any excessive threat. For example, what should happen is all nerve endings everywhere, which are mostly located in the skin or the tendons or ligaments, have a normal level of activity. And what this is around minus 70 millivolts. It's just electrical activity, where that nerve ending is detecting information constantly, 24/7, about the degree of information. So if it was a nerve ending that detects stretch, it's always looking out, is there any stretch, is there any stretch? If I stretch that area a little bit, the signal changes. It gets a little bit higher, but nothing really happens. If I overstretch my elbow, that signal is going to go high enough to some kind of threshold, which usually is around minus 50 millivolts. It gets more positive because there's some changes in the electrical charge around the area. And as that threshold is hit, information gets sent to the brain, and then you either become aware of the pain or you have a reflexive action where you protect the area because it was overstretched. The problem is that when it becomes oversensitive because of trauma, overuse, or overwhelm, then that resting level of activity changes. It gets much closer to the threshold. So now it only takes a very normal amount of stretch for my brain to perceive a huge stretch, and so you're more likely to feel pain. Using the method we've already talked about, which is finding those areas of sensitivity and its compensation, we can reset that level back to the normal minus 70 millivolts to then have a normal amount of movement without threat. Cool. The biggest part of the treatment process in the clinic generally is our third step. It's all about desensitizing the nervous system to the threat in the area of which you may feel pain. But of course the question is, how on earth do you do that? Well, when we have explained the process of how pain works, we recognize that as a response to threat, the nervous system can only do a few things. It can change the contraction of muscle tissue, and equally, it can change the secretion of hormones. Now, it's not very realistic that we test hormones because we have no ability to do blood tests on a second-to-second basis. But we can use manual muscle testing as a means of figuring out how does the nervous system perceive this area. And so if I have a hip problem, what we're going to do is we're going to test all the muscles that govern the hip. Now, we're not looking at strength. The best way to think of it is we're looking at your ability to connect with that muscle. And so when we test it, what we're actually testing is a reflex. Just like when you've previously had your reflexes tested, where you tap the tendon and you get a reflex response of the muscle. In this case, it's a slightly different reflex, in which where we apply pressure to the muscle, it should have an ability to kick back, and you should be able to apply some force to match us. But in many cases, the nervous system will either switch that off, and so the muscle will look weak, or it will increase the connection to that muscle, and it will seem really tight, and it will look super, super strong. But both are actually abnormal and dysfunctional. And so what we have to do is identify where is the information coming from that's causing the brain to create that abnormal response. And most of the time, this is because of heightened sensitivity in the nerve endings around the area. For example, if I have a sensitivity in the outside of my hip, it may well be in one of the tendons. And so what should normally happen is I should be able to stretch that tendon a little bit and nothing happens. If I was to repeatedly stretch that tendon over and over and over again, then eventually it will be normal for the muscles that govern that area to switch off in order to protect me. But if I've had some trauma, and if that trauma is healed, you may be left with some heightened sensitivity. So now, even the smallest bit of movement causes the muscles to change function. And therefore, your brain is getting information that there's a threat. And so by finding the source of the faulty information and resetting that, which we're going to talk about next, we're able to reduce the perception of threat in the area, which should then have a role to play in reducing the pain that you feel.